It's a quick scan of the room. I'll start. First, I'll sanitize my hands. And I'll wipe my stethoscope. And I'll introduce myself. Good morning. My name is Sarah. I'm a student nurse from Seneca College, and I'm here this morning to do your general head-to-toe assessment. Please, before we start, can you state your name for me and your date of birth, and I'll confirm with your ID. Name and date of birth is stated and is same with the ID. So before we continue, do you want to use the washroom at this time? No, you're okay. Are you comfortable where you're seated? Okay, so I'll be providing you with privacy. Privacy has been provided for my patient. Then we'll move to the general assessment. And for the general survey, I'm going to start with the physical appearance. The patient is age is appropriate to the age the patient has stated, and the skin color of the patient is genetically the same with the background of the patient, and there's no any odor. Then for the body structure, the patient is seated in a well positioned, and the posture of the body, please can you just stand up, sit down. His posture is fit, and the age is appropriate to the patient's age. The nutritional distribution of the patient, the fat is evenly distributed in the body, and there's no any physical deformities at this time. Then for the behavior, the patient's mood is friendly, the patient is well dressed for the weather, the personal hygiene, the patient is clean, and the patient is maintaining a good eye contact with the examiner. Then for the mobility, please could you just walk down to that side and back. When the patient got up to walk, the gait is smooth and well balanced. Can you just flex your hands for me? Thank you. For range of motion, it is smooth, accurate, and is even. Then for work of breathing, the patient is breathing effortlessly. There's no any distress. It's smooth and it's well balanced. Then for level of consciousness, please, can you state your name again? Do you know where you are? What time it is? Patient has answered these 3 questions. It shows that the level of consciousness is, the patient is alert, he's awake, and he's well oriented. Then we'll be moving to the head inspection, and I'll start with the skull and the scalp. I'll inspect and palpate the skull and the scalp. For the skull and the scalp, do you feel any pain? Okay, there's no any pain. There's no any tenderness. The hygiene of the head is clean. There's no lumps. There are no any swollen on the head. Then I'll now be inspecting and palpating the hair. So for the hair is evenly distributed and there's no any infestation. Then I'll now be palpating for the facial structures. So for the facial structures of the head, is symmetrical. Do you feel any pain? The temperature is warm. There are no lesions. There are no scars, and there's no any swollen. Then I'll now be testing for CN7, which is called the facial. So for the facial, can you smile for me? Can you frown? Pop out your cheeks. Shrink, shut your eyes. So during the CN7, the patient did all this, and all the signs are symmetrical, and his facials is intact. Then I'll now be moving to the eyes. For the eyes, I'm going to be inspecting the lashes, the lid, and the eyebrows. So for the eyebrows, there is no any discharge. For the eyelashes, they're evenly distributed on both sides. There's no discharge on the eyes. There's no any lid lag. Can you close your eye and open your eyes? No lid lag. There's no crusting in the eye. Then I'm now going to test for CN3, which is the oculomotor nerves. So I'll now be testing for the pupil size. For the meter, it's 4 mm on this side and it's 4 mm on this side. Then for the symmetrical, the eyes are both equal on both sides. Then for shape, the eyes are round. And then for the direct and constitutional light reflex, okay. So you convergent light reflex, you put the light at the side of the eyes of the patient and bring the light together. And when I did the direct and the constitutional light reflex, the both eyes constricted. Then for the level of accommodation, can you look at my pen, the tip of my pen? I'm going to be bringing it close to your eyes. Thank you. So during this testing of the accommodation, when the eyes were both dilated at the moment, then when the object was taken closer to the patient's eyes, they both converge, indicating that CN3 is intact. Then I'll now be moving to the ears. For the ears, I'm going to be inspecting the ears first. So there's no any discharge in both sides of the ears. There are no any swollen. Then I'm going to be palpating the auricle and the tragus of the ear. So do you feel any pain? No? How about now? No pain. So for the auricle and the tragus, they are both intact. There are no pains or no tenderness. Then I'm going to be doing the 3 whisper word test. Please repeat whatever I say to you. So for the 3 whisper test, patient has repeated the words I said to him on both sides of the ear, indicating that his ears are intact. Then I will now be moving to the nose, and for the nose, I'm going to be inspecting the nose first. So there is no any discharge on the nose, and there is the nose is in the midline position. Then I'm going to be palpating for the frontal and the maxillary synaesthesis. For the frontal, do you feel any pain, any tenderness? And for the maxillary, any pain or tenderness? So they are both intact. Then I'll now be moving to the mouth. I'm going to be inspecting the mouth starting from the lips. So for the lips is well dehydrated. There's no swollen. There's no any lesion. Then please can you open your mouth? The gums, there are no swollen in the gum. There are no lesions. There's no bleeding. And for the teeth are well positioned, and there's no any loose teeth. For the tongue is in the midline. There's no any swollen on the tongue. Can you raise the base of your tongue? And for the basement of the tongue too, there's symmetrical and there's no lesion. Then I'm going to be checking for the heart and the soft palate. Can you please open your mouth again? So the heart and the soft palate is intact. There are no lesions on the heart and the soft palate. Then now I'm going to be testing for CN9 and 10. CN9 is the glycosopharyngea and the CN10 is the vagus. So I'll ask the patient to say ha. So when the patient says ah, the uvula and the soft palate rise up, indicating that CN9 and CN10 are both intact. Then I'll now be testing for CN12. And for CN12, please can you open your mouth and bring out your tongue for me? The tongue is in the midline position. Can you move your tongue side, both sides, left, right? So can you say light, tight, dynamite? Patient has repeated what I said to her, and CN12 is equally intact. There are no tremors on it. Then we'll now be moving to the neck, and for the neck, I'll now be inspecting the neck first. Upon inspection, the neck is symmetrical. There is no any physical deformities in the neck. Sorry, I will palpate and inspect. There's no any physical deformities in the neck. There's no scar. There are no lesions, and the temperature is equally warm. There is no any swollen. Do you feel any swollen? The thyroid is not deformed, and the hair on the neck is evenly distributed with the body hair. So I'm now going to be palpating for the carotid arteries. For the carotid arteries, I'll be palpating each side first. So I'll start with the left side. So for the carotid arteries, I'll palpate for 1 hour and 1 minute, and the rate is 14 beats per minute. The rhythm is regular, and the grade strength is +2, and it's same this side. Thank you so much. Then I'm now going to be testing for the CN11, which is the spinal accessory. So for the CN11, I'm going to put my hand, just try to make a resistance by turning to this side. How about this side? Did you feel any pain? No? Okay, then I'll put my hands on your shoulder. Try to pull up your shoulder up. Did you feel any pain? So patient did not experience any pain, indicating that CN11 is equally intact. Then I'm now going to be moving to inspecting the upper extremities. And for the upper extremities, I'm going to first inspect it. Then can you roll off your sleeve? Okay, so there's no any scar, there's no lesion, there are no there are no deformities on the upper extremities. The hair are both evenly distributed, same in this side. Then I will now be palpating the upper extremities. Do you feel any pain? The temperature is warm. There are no swollen. There are no any deformities that I can feel at this moment. Okay, then I'm now going to be checking his fingers. Can I please see your fingers? Okay, so the nails are pinkish in color, and then the capillary refill is nice and it's even. Thank you. Then I'm now going to be moving to test active range of motion. And for the test active range of motion, please, I'm going to ask you to stand up and demonstrate everything I'm going to do. So can you flex your fingers, extend it, flex your wrist, extend your wrist, radial deviation of your lip, your wrist, ulnar deviation. Can you flex your elbow, extend your elbow, in a supine position of the elbow, pronation position of the elbow, adduct your shoulders, adapt it, inter-rotation of the shoulder, external rotation of the shoulder. Did you feel any pain? No? Okay, so patient has done all this and the patient did not feel any pain. So range of motion is equally intact. Then I'm now going to palpate the radius. And for the radius, I'm going to be palpating for 1 minute. So after palpation of the radius, the radial pulse, it is regular and the grade strength is +2. Then I'm now going to be checking for the hand strength of the patient. Can you just hold my hand and pull it? Did you feel any pain? So the grip strength of the patient's hands are strong. Thank you so much. So now I'm now going to be moving to the lower extremities. And for the lower extremities, please, I'll be asking you to pull up your trousers up, your pants up. Okay, so I'm going to inspect the lower extremities first. I don't see any scar, there's no lesion. They are both symmetrical. The hair is evenly distributed on the patient's laps, and there are no any physical deformities. Then I'll be palpating it. The temperature is warm, there's no tenderness, there are no lumps, and there are no any troubles on it. Thank you so much. So now I'm going to I'm now going to be palpating the dorsal pedis. So for the dorsal pedis, it's on top of the feet. I'm going to palpate for 1 minute. The reading is regular and the grade strength is +2. Then for the posterior tibialis pulse, I'm going to be palpating also for 1 minute. It's just behind the ankle of the leg. So after palpation, the reading is regular and the grade strength is equally +2. Then I'm now going to be doing I'm now going to test for flexation of the feet. I'm going to ask the patient to lie down on her back. Then for the dorsal flexation is when the patient is lying down and then you put a resistor and ask the patient to put the leg backward. And for the plantar fixation is when the patient is still lying down and you put your hand at the back and you ask the patient to try to extend their foot forward. So it is like this. Did you feel any pain? Okay. And for the plantar fixation is forward. Did you feel any pain? No pain. Thank you so much. So it indicates that the patient's feet are both intact. I'll be sanitizing my hands again. Then I'll be moving down to the inspection of the posterior thorax. And for the posterior thorax, I'm going to be asking the patient to please pull up your shirt up a little bit. For the inspection, the back is symmetrical. I don't see any physical deformities. There are no scars. The hair distribution at the back is even, and there are no any swollen that I can see. Then I'll be palpating. Upon palpation, do you feel pain? The temperature is equally warm. There are no masses. There are no any lesions. Thank you so much. Then I'm now going to be palpating the posterior thorax. So for the posterior thorax, I'm going to ask you to be taking deep breaths while I palpate. Deep breath in, out, in, out, in, out, in, out, in, out. So when the patient was taking deep breaths in and out, there was no any crackling or whistling sound. This is an indication that the lungs are clear. Then I'm now going to be assessing the anterior thorax, and for the anterior, before I assess that, I'm going to check for the ratio, and the ratio for the anterior and the posterior transverse is 2 to 1. So it's ratio 1 to 2 for the AP ratio. Then I'm now going to assess the patient for the anterior thorax, and upon assessment, after 1 minute, the breathing is 14 beats per minute, the reading is regular, and the respiration is equally smooth. Then I'm now going to be oscillating for the heart sound with the valves, and for the heart sound on the valves, there are 4 valves that I'm going to be checking. The first one is on the second right transcostal space, which is called the aortic. The other one is on the second left. It's called the pulmic valve. Then I have the transcuspid valve, which is the 4th lower space. Then the 5th one is at the mitral valve, just beneath the breast of the woman. So they are here. This is the aortic valve. This is the pulmic valve. Then this is the transcuspid valve, and this is the mitral valve. And the heart sounds are clear. Then for S1 and S2, S1 will be found beneath the transcuspid valve and the mitral valve at the apex, while the S2 will be heard clear on the aortic and the pulmic valve, which is at the base of the valves. That's where you hear the clear sounds of them both. Then I'm now going to be palpating the abdomen. So for the abdomen, I'm going to ask the patient to lie down, take up your shirt a little bit. Then I'm going to be covering the patient a little bit. Upon inspection, the abdomen is on the midline position. There are no scars, there are no lesions, they are both symmetrical parts, and there are no any deformities. So I'm going to be auscultating the abdomen now. I will start anti-clockwise from the lower left quadrant to the upper left quadrant and the upper right quadrant and then the lower right quadrant. So upon palpation, I did not hear any sound on the abdomen. The abdomen is intact. Then I'm going to be palpating it with light palpation on all the 4 quadrants. Do you feel any pain? No pain? Okay. So the abdomen's bowel sound is intact. Then I'm now going to be palpating for the bladder, and the bladder, upon palpation of the bladder is not full, and that ends my assessment. Thank you so much.